Stretch marks are a problem that many people have to deal with. Most women after pregnancies will have some on their abdomen. Guys can have it too after weight gain. It's something that is unsightly, people want to deal with, but there's a lot of things out there on the market that really don't address the problem. Stretch marks happen because the tissue gets pulled beyond its elastic potential to recoil, and it stretches and almost breaks that skin. The skin's layers are the epidermis on the top, the dermis, which is the strength part of things, and then underneath it is the fatty tissue layer. And when continuous pressure and hormone influences and things are affecting that tissue, it can overstretch in spots, and that makes a stretch mark. Now, and it's thinner in those areas than it is in the surrounding skin. So you can imagine anything that you put on topically, like creams and things, aren't going to change that. Anything you shoot at it, like a laser or anything like that, is not going to change that thickness of that tissue. It actually takes cutting that tissue away in order to get rid of it. But we don't just cut along a stretch mark and take it out and stitch it up, because you'd end up with a scar in that area. So that's not a good answer either. The best way that we find to take care of stretch marks like on the abdomen is when we do an abdominoplasty. Usually those stretch marks are on the lower part of the abdomen, where things have stretched the most with pregnancies and with weight gain, and that's the tissue that gets to be taken out from the tummy tuck. So the good thing is you cut away that tissue, we stretch the upper part down that doesn't usually have as many stretch marks, and the stretch marks are gone. But don't waste your money on crazy things that aren't going to work. Just consider possibly a tummy tuck if that's where your problem areas are.